Hello, and thank you so much for joining us today. My name is Jasmine Alderson. I'm the spa director here at LUX Medical Spa, and I'm joined today with Blair. She is our MERS Portfolio Regional Director. She's been with MERS for over 6 years. So today she's going to discuss with us the Neocutis Skin Care brand, which is one of our favorite brands that we carry in the office. She also works with our Radius filler, which she did a presentation earlier this week. If you didn't get to join us for that, please check out our YouTube channel where we saved it there. And so Blair, go ahead, take us away. Before I start, I'm so sorry. If anyone has any questions, please feel free to either message us on Facebook. We are going Facebook Live, or you can send me a private message through the Zoom call if you're listening that way. Let me turn this off real fast. But we are being recorded so that we can share this presentation with everyone via YouTube later. All right, Blair, go ahead.
Thank you, Jasmine, and thank you, Lux, for joining us this afternoon. As Jasmine mentioned earlier this week, I spoke to one of our favorite fillers, Radius, which is a dermal filler from the MERS family. And today we're going to talk about its sister product, the Neocutis Skin Care line. And we all talk about in taking care of your investment. We get laser treatments, we get chemical peels, maybe we just need to repair from sun damage, but your daily skin care is such a vital part of your skin health. And so today we're going to talk about Neocutis. And before we do, I do like to share a fun little story. I worked in plastic and dermatology in Nashville, Tennessee for many years before I joined the MERS family. And the dermatologist I worked for did the clinical trials on Neocutis PSP. And a little bit when we talk about PSP, you'll see that this is so much more advanced than your Sephora and your Ulta. These processed skin proteins have been studied in clinical trials, not just satisfaction trials. And I have been a part of the Neocutis family for now almost 15 years because when it came out, it was my favorite product. And I'm still using Lumiere and Journée and BioCream and BioSerum Firm, which is brand new to this day. So I always got excited when I went to work for MERS and we sold the little blue boxes. So before we start, let's talk a little bit about the aging face. So over time, when our bodies begin to reduce collagen production, reduce elastin production, when it comes to skincare, when it comes to skin health, what you begin to see is basically a disruption of your collagen matrix. And around the age of 28 years old is when our bodies start to stop producing collagen. That's a tough pill to swallow. So around 28, we start to stop producing. And from there, we lose about 1% every year until we become a more advanced stage of collagen loss, and it goes up to even 3% a year. And when you are losing the collagen, what happens to the surface is wrinkles, dehydration, that little bit of pinch that you get in your skin or you get on your cheeks. That's because of collagen loss. But we're also made up of elastin fibers, and elastin fibers are very unique, and elastin fibers are what help us move our neck. So when you are looking in the mirror and you start seeing these little lines, or you realize that this texture is a little bit different than the cushion in your face, that's because that has more elastin fibers that we're losing than the collagen that we're losing here. And another element of what we're losing is hyaluronic acid. And that's a very popular word in the cosmetic world. It's just about as popular as collagen because hyaluronic acid is what holds onto your moisture. And so when your skin is dehydrated and you need a good fill of water to make it plump again, it's lack of hyaluronic acid. And as you may or may not know, we use hyaluronic acid fillers in the dermis. We inject it into the skin to give it a plump and filled look. It's just as imperative on the topical as it is underneath. So here's I love this little example, and I remember exactly how old I was when I found out how old we are when we start to stop producing elastin. Now, I've known the collagen secret for a long time, and at collagen, 28, 30 years old. Well, elastin production begins to decrease at around the age of 40. Why do I remember that day? Because I was 40 years old when I found out. I'm 40 now, and this was something that I just recently learned in skin histology, that elastin starts to stop at 40. Ooh. And you can see also hyaluronic acid occurs around that 28 to 30-year-old age. Collagen has several different structural supporters. You've got a collagen 1, a collagen 3, and a collagen 7. And these are the collagen fibers that we want for physical health. So if you're looking at your skin and what looks healthy on the outside, we want that production. And you'll see here that we have the studies to prove that Neocutis actually does produce that collagen topically. And if you also look at this little slide, you can see where we begin to drop off and how fast it advances when we lose it. So having a good skincare regimen is not just important for turning back the clock, it's preventative as well. Starting young, wearing your sunscreen and getting your hyaluronic acid in your skin, protecting your elastin fibers and stimulating collagen is something that can start at all ages. Here's a little example of what goes on below the surface. This is your extracellular matrix. And these are these little, you see these little lines here and these little fibers, and they're working together, making these little lines. And what they're doing is they're communicating with each other. And they're communicating and they're staying bonded. And when they stay bonded, skin stays firm. But as we age, those fibroblasts begin to disintegrate. And that's where we get the little wrinkles and the little lines and the texture results that we want to correct and prevent with proper skin care and other procedures. So what is collagen? We're not going to go deep into this, but I love this part. This is so fun. Collagen 1 is stronger than steel. That is how strong a collagen 1 fiber is gram for gram. So you imagine how imperative it is to keeping your skin healthy and intact, keeping that cushion in your skin. Your collagen 3 is a component of your extracellular matrix, and that's what helps keep you organized. And then that collagen 7 is all about connection between the dermis to the epidermis. So that is what we lose when we spend time in the sun and we don't wear a sunscreen and we're getting those outside factors that are breaking down our collagen. Timeline of collagen, I think we kind of already gone through this, that we begin to break it down at a fairly early age. And there are inside and outside factors that cause collagen loss. Intrinsic just means it's natural. It happened to us. We're aging. We can't stop it. But the outside factors, sun, smoke, alcohol, environmental damage, lack of sleep, all of these things that we do that we know hurt our body on the inside, break down our collagen on the outside as well. And while we want to use all preventative measures and avoid those things, adding in, a collagen stimulating product or procedure or treatment is what will be safe for you. So here's elastin. We talked a little bit about this. Elastin is that firm, that bounce, and not that sag. I really do like to always think about mother, daughter, grandmother, and neck. So when I was 30 years old, my mother would have been about 60 years old. My grandmother was 75, 78. She wasn't quite 80. We look alike. We look so much alike, it's scary. But you could do a pinch test from neck to neck to neck. And all of that is the elastin fibers and the elastin breakdown from over time. So when you think about elastin, think about one of those squeezy balls, those little stress balls that I probably have somewhere here in my home office. And when you squeeze it, you want to bounce back. And that is thanks to the elastin in our fibers in our skin. Timeline of elastin, we've already discussed this, that starts to break down a little bit later in life, but when it does, it breaks down really fast. And hyaluronic acid, again, it is your water holding component. It is a big drink of water, and it's so vital for the hydration and the even natural glow of your tissue. This slide here, I always like to take a moment on because I think it's a neat little concept. Hyaluronic acid works with your skin like a sponge. So if your skin is dehydrated, it's weak, it's damaged, and what you are basically are a nasty kitchen, not nasty, excuse me, but just, I think about my sponges I should probably throw away. You're a kitchen sponge, and it's been sitting out, it's been drying, and it starts to break down, and you see all those pores, and you touch it, and it's crispy. But what happens when you put it back in water? It pulls right back up, and it rehydrates the skin. This essence of hyaluronic acid, it's not going to necessarily turn back the clock, but it's definitely going to give your skin and help rebuild a suppleness that you do lose over time. So patient needs. Now, let's talk about the fun stuff. products. So we are at LUX, we are a processed skin protein family. Processed skin proteins were the first member of the Neocutis family and are still our go-tos to this absolute day. Processed skin proteins have a beautiful history, a beautiful study history, and I'll show you a slide. And what we are proven to do is to fortify and create collagen. And we know this because we did our studies on burn victims. And if you think about aging, aging is injury to your skin. So when we studied PSP when PSP was created, processed skin proteins, it was studied on burn victims. And the rate of healing was so fast, it was like a no-brainer. Why would we not use this as a post-procedural product? And then the no-brainer was, why wouldn't we use these products every day for continual collagen stimulation? Because aging of the skin is injury. That is an injury every single day, especially if it comes from an outside source. So, summary, reveal new skin with Neocutis, because with Neocutis, we have clinical proof that we help regenerate and help create collagen. We help retain and stimulate elastin fibers, and we help rehydrate with hyaluronic acid. So let's talk about the products. What does Neocutis mean? Since day one, Neocutis means new skin. What a great feeling to think about that on a day-to-day basis when you're in your bathroom and you're getting your little pump and you're putting it on, you're doing your eye cream, your day cream, you're washing your face, and everything you do when you touch this luxurious product is think new skin, rejuvenated skin. I am feeding my skin something that I've been losing because of the aging process or the post-procedural process. Processed skin proteins are a Swiss technology. They were actually developed in Lausanne, Switzerland, and it was a processed skin protein was based on fetal skin healing scurrilously. They knew that, and so by understanding the concept of why that skin healed so scurrilously, they were able to develop a processed skin protein that mimicked that action. And in 2005, wow, I said it, about 15 years, PSP was commercially launched as BioCream, and that was the beginning of the beauty of Neocutis in the cosmetic industry. So this slide, I always take a pause. I know it's such an uncomfortable feeling, but this child was burnt with scalding hot water. And I mean, it's a terrible picture. When I worked in dermatology, I remember always pausing, like, I hope you're comfortable with seeing this. But if you see how fast this child healed after a 3rd-degree boiling, scalding water burn. And what they did is they took the processed skin proteins and made a little tiny patch. So they put it all over the injured skin in patches and let that sit there and heal, almost like like a sheet mask that we use these days, and let it heal and soothe his skin. And what a great fast recovery rate, just like something we've never seen. And this study detail, I think, is important because we do a lot of procedures in office that cause injury to the skin, whether it's a laser or microneedling. I mean, there's this old school CO2, and then there's baby fractionated lasers. There's so much out there, even a chemical peel, where your skin is in a compromised state to recover. Why would you not want to accelerate recovery by using a product that is post-procedural and anti-aging at the same time? This picture right here, shows you, this is the proof is in the pudding. This was a study done using a optical imaging tool. This 3D in vivo imaging tool is not something typically used in cosmetic studies. It's used in clinical studies. And this shows you how much work has gone into in backing up the science and the power of PSP. And you can see here the collagen stimulation before and after 6 months. Look at the thickness and that little purple line right there. Look at the plumpness and the extra curves that were created. And even that little top line that you see right there, that's health of, on the after 6 months, that's the health of the epidermis. So the skin did not only thicken and create collagen and create hyaluronic acid, it even became more protected on the surface. And then here is, I mean, crow's feet for days. That photo was able to go in and literally measure every single line in a crow's feet to help show that that PSP had stimulated the collagen to soften those lines. So post-procedure, Let's talk about it. You guys go to LUX. You ladies and gentlemen, if you're in the room, go to LUX for why. You go to feel better, look better. You have aesthetic goals. They help you reach your aesthetic journey. There's a lot of things out there that you could be choosing, and everything between you and your provider is there to help create your end goal. But all of these procedures involve some need of post-care. BioCream, BioSerum Firm, Lumiere, all these Neocutis products are right there in line to fit into this age, well, any age demographic, but anything, whether it's microablative, chemical peels, even non-surgical tightening and chemical peels. Personally, if you guys have ever experienced like a really heavy peel where, I mean, you are shedding sheets of skin, the end all be all is just pats of BioCream all through that new skin. It's such a relief when you do that, and you know that you're stimulating more collagen because you're doing that. All right, well, I've talked about it. Let's see it. It's Neocutis BioCream. That was our very first, and it's proven with the PSP. It has human growth factors, interleukins, cytokines, and state-of-the-art skin revitalization. All those details sound fun, like a bunch of words with a bunch of syllables, right? BioCream has no smell whatsoever. It is approved for the most sensitized skin, yet it's powerful for the most aged of skin. When you pump it out, it has a beautiful, light, silky feel. There is also a BioCream Riche if the skin is more dehydrated. But after a procedure, or even after a washing your face with a really strong glycolic face wash, putting BioCream on right after gives you not only that long-term collagen stimulation, but the skin looks so soft and supple and soothed. So this is it. This is our one of our favorites. Until we talk about Lumiere. So Lumiere, for one, has won over 15 beauty awards since its creation. And these are beauty awards from everybody from Allure all the way up the chain to the new beauty awards. Everybody wants their hands on Lumiere. Lumiere has 30% more of the processed skin proteins. So if you think about it, we need the processed skin proteins to stimulate the collagen on the face. Your eyes are so much more delicate. So why not put 30% more in this little tube? And not only that, it has other things that our delicate eye area needs, such as caffeine, extra hyaluronic acid. And it's really cool. This product actually has been studied by ophthalmologists to be approved to go from your brow line all the way down to your lash line. There is no other product that has that study approval. So other eye creams that, sure, they're fine for under the eyes, might be too harsh for your lash line up to your brow line. And I earlier said I like to tell y'all stories, and I do have a lot of stories, especially with my love of Neocutis products. For probably about the past 5 years, I've been using Lumiere as my face hydrator every single day. Why? Because I have rosacea, so I want the caffeine to help reduce the redness, and I want that 30% growth factor every single day. I get picked on around with company members. They call me Lumiere Girl, and I posted selfies on Facebook with a big bottle of Lumiere. That's how much I love this product, and so I like to confess that may not be for everybody, but that's how much I love that 30% extra growth factor. And then post-procedure, again, these are, we know that all these products are there for post-procedure, but they're also there for everyday use. So let's go through a couple of other products. Here on your blue side is your Journée. Journée is your BioCream moisturizer, but with your daily sun protection and your antioxidants. So green tea and vitamin C are added for daily antioxidants. An SPF of 30 is added for daily protection. That 0.05% of PSP is added there for growth factor stimulation. And it also has a really nice little tint. I would never call it a tinted moisturizer, but I would call it a glow. I think even a gentleman could get away with it because all it does, it just kind of blends into your complexion, helps reduces little extra things like little redness or textural issues, but just a little extra glow blended in on top of it. Such a great product. And then here we go again. We already talked about our BioCream. Love it. 5%. Lumiere Riche. We got this Best in Beauty by here. And then BioGel is the gel version of BioCream. It's a little bit lighter. Someone who might have a little bit of a more oily complexion and want the processed skin proteins, need a little space, need a little less hydration. And bioserum. So we're going to take a second to talk about this because Lux just announced to me at 3 o'clock that we're about to be welcoming in a brand new product that has just launched. It's launched so much that we don't have it in the slide deck. Bioserum is your super serum. It is 100% more growth factor. It has your antioxidants. It has your antioxidants. It has your hyaluronic acid added. The one thing that Bioserum did not have was the MPC technology to help generate elastin fibers. So what you see here, Bioserum and Microserum, 2 different products. MERS just launched, put the 2 together, they made a baby, and we named it Bioserum Firm. It has a proprietary hyaluronic acid additive, so it actually boosts hyaluronic acid 5 times better than Bioserum's traditional. It has the MPC technology, which is there for elastin fibers, and it has all the power of Bioserum Original that has been an end-all be-all. And ladies and gentlemen and people here at this event today, if you're looking at your skin and maybe it's quarantine stress, maybe it's stress of aging, maybe it's sun damage, if you look in the mirror and go, I need a supercharge, I need to do it and I need to do it fast, you can go 0 to 90 with Bioserum Firm. Let me say it, with Bioserum Firm. The product gives your skin an instant tautness. And the moment it's in your skin, it starts supercharging collagen production. It is absolutely blown our minds. The response has been amazing. And I'm so happy that Lux is going to be bringing in Bioserum Firm. You guys are going to be blown away by it. And, you and your esthetician and the staff at Lux talk about what protocol is best for you. Some people like me, I have 18 different skincare products, and I'll pick a day. I'm like, I want to use a Journée today, and then I'll pick another day. Oh, I'll do BioCream with, I love skincare, but that's not for everybody. If you need a simple routine, discuss that with your esthetician, and they can help build out what's right for you. But I can absolutely assure you that if you want supercharge, you want 0 to 90, Bioserum Firm is that product for you. It is unbelievable. I'm so proud of our chemists finally getting in there and figuring this out and making this out there for us. Jasmine, I think that I am, here's a little before and after of Bioserum, unretouched, after only 2 weeks. Jasmine, I think I'm done on the presentation as far as introducing the products and talking about the processed skin proteins. Is there anything that you would like me to add or any questions you would like me to answer for you and the Lux staff, and then of course for our guests today?
Well, I had people saying they had questions, but every time they would type it, you would answer it. So you did a great job with that.
Oh, thank you guys.
We had one person say, where do growth factors fit into my regimen if I'm doing antioxidants, retinols, and sunscreen?
Oh my gosh, that's it. That is the final one. So you already have what we call the core 4. If you were to have just your core 4, that's exactly right. You would be doing a retinol, sun protection, antioxidant. However, by adding growth factors in, the one thing you're missing, so your retinol is doing what? It's causing cellular renewal, right? That does help increase collagen stimulation, absolutely. And depending on which retinol you choose, it could be a trend where it goes super fast, or it could be a slow moving one. However, that is turning cellular turnover, causing that collagen stimulation over time. But the growth factors are what goes back and helps feed your skin and helps basically, think of it like a warm hug to your collagen fibers. You've got the retinol pushing them out, your vitamin C's or whatever your antioxidant is, that's being used to help protect against environmental factors. So the sun out there, the pollution factor, whatever it is, just breaking down a skin, your antioxidant is protecting you, but your growth factors are in there working within your collagen to give it a warm hug and help to stimulate more. So especially if you tend to get sensitive from retinol and or antioxidant use, anything in the Neocutis PSP program would not only stimulate collagen and help glow, cushion, health, wrinkle reduction, it also would help soothe your skin at the same time. when I worked in dermatology, again, telling a story, we would put our patients, especially somebody that was in their early 20s or maybe early 30s, getting ready to try their first retinol. And if you guys have ever been on a professional medical strength retinol, like a tretinoin, it's tough stuff at first. It really is. And they used to call me the bio cream whisperer because I wouldn't let them walk out with a script of Tret without having a bio cream as backup to help recover their tissue, and not just recover, but do double duty and make a collagen party on their face, in their skin.
That's a good one. Someone asks, how is growth factor for rosacea?
That's a great question. So where it is not necessarily for rosacea, rosacea is a condition, it's a vascular condition. It's not necessarily for, but anything in the PSP family is not going to exacerbate or hurt your rosacea. If anything, it's going to at least help calm it down. Rosacea is an interesting condition, and I've suffered from it since 18. Anything that you can do to help reduce vascular activity will at least improve the appearance of it. And earlier when I said that I've been cheating, I've been I've been a Lumiere princess for so long. I like the caffeine factor because caffeine is a vasoconstrictor. So it makes those little vessels in your tissue kind of shrink down. And it's not a correction. It is not correcting my rosacea, but it is helping put a little vasoconstrictor Band-Aid on it to reduce my cosmetic redness. I hope that helps answer the question. Definitely, if you have rosacea and you have that condition, talk to your dermatologist, go into LUX, talk about your other RX, possibilities and treatments and everything. But again, just like with retinol use, if you're on any rosacea medication, BioCream, anything in the PSP family will be a peanut butter and jelly to that program.
Great. What is your favorite product? I think we know, but what is your favorite product?
Lumiere. Absolutely Lumiere. I've known them. I love them all. I know them all. It's going to be next time when we have an event again, it's going to be Bioserum Firm, no doubt. I know it is, but I'm such a loyalist. I'm such a Lumiere loyalist that even when I realized that Bioserum Firm is a game changer, and if you think about it, for someone like Jasmine and I, we've been using Neocutis for so long, there's no telling what our skin health would look like without having used it for so long. I know when I give myself a good 90 days of full Bioserum Firm, it's going to become my favorite, but it's going to be hard to say because I love Lumiere so much.
That's good. That's a good one. So we have a couple of our providers here. We have Christine Prebanik, she's one of our estheticians in the Hilton Head office, and we have Erin Hutchinson, our nurse practitioner in the Hilton Head office. I'm going to ask them the same question. Christine, what is your favorite Neocutis product?
Well, she kind of took the words right out of my mouth because I was going to say Lumiere too. But it's funny because all these years I've always said, using an eye cream is going to be preventative, always preventative, not corrective, as far as when we get into, aging process. But the thing is, and like you can see this picture right here, which is perfect, you can see that even though, aging process has picked up, you can see the difference of actually using a growth factor around the eye area. So it's amazing. Yeah, it's truly a great product.
Thank you, Christine. And Erin, what about you? What's your favorite Neocutis product?
So I've only tried two of them. I've tried the Bio Cream Riche, and I got that because my face was dry whenever I had started the Luminous cream, and you'd think that I wouldn't need such a thick cream after that, but it's been nice. I've bounced between that and the moisture therapy and all my dry spots, and it helps a ton. I've even started taking that bio cream and I mix it with my neck define and put it all over my neck and chest. So yeah, I love them both though. I've got the Lumiere is great. I feel like I do put that on the upper lid, like she mentioned, like Blair mentioned. I go all the way from my lateral canthus, kind of underneath the eye, all the way medially, and then on my whole upper eyelid, I do that. But I use my Lumen restore at nighttime first under there, and after that dries, that's whenever I put the Neocutis on top. I think it might be overboard, but I feel like it's helping.
Well, you sound like you're like Blair, where you use a little bit of everything and play around.
Once a skincare junkie, always a skincare junkie. Welcome to the world, Erin.
Oh my gosh, my bathroom is ridiculous. Every time a friend comes over, they're like, "Oh my gosh, what is all of this?"
That is too funny. My favorite is Jornay, and it always has been. And I think it's underrated in our office. I think we could certainly be talking about it more, but because it's like a 6-in-1. And did we talk? Blair, did you talk about it, Jornay?
Yes, we did.
Okay.
So
Okay.
Jornay,
I zoned out for a second, but.
oh, absolutely. So Jornay, I like that you said, it's like it can sometimes be overlooked and can be a little bit of an underdog. But the fact is, it is a one-stop shop. You've got antioxidants, you've got sun protection, you've got growth factors, you've got moisture, and you've got that little bit of tint, which gives your skin a glow. So, you know, in that world of where you're deciding where you want to be in your skincare regimen or journey, pun intended, Jornay is a perfect day option for you. It doesn't require a lot of layering. It's an easy, it pumps out. I mean, it lasts forever. So yeah, it's a great product. And
Awesome.
And it also pairs well with other products too. So if you're using it with a serum, it sits beautifully on top of it. It doesn't create kind of that roll when you overuse products.
Yeah, awesome. Does anybody else have any questions, or anybody else want to share what they have used or what their favorite product is? We can make this as interactive as you would like, or you can stay anonymous and send me questions or comments in the chat function. Well, while those are coming in, I'll give everybody a second if they do want to send something. Just as a reminder, Neocutis is 20% off all week, so you can shop online from our website. You can call us, of course. It's 843-781-6672, or you can stop by either office and pick up your favorite products while they are on sale. If you're not sure which products are right for you, or you need help navigating through the line, or anything that we do here, all month long we are offering free virtual consultations, which is a $49 value. So you can talk with Christine or talk with Erin or any of our other wonderful providers, and they'll help you pick out a skincare regimen that is best for you. And if anybody has any final comments or final questions, I'll stick around for another second. But if not, Blair, thank you so much for the wonderful presentation. I learn something every time I listen to you, so I appreciate it.
Oh, thank you, Jasmine. I appreciate you guys having us. We love the LUX family, and we love being a part of it with you.
Yeah, thank you.
Is it okay if I ask a question?
Yes, absolutely.
Yes, absolutely.
My name is Chelsea, and I have a 4-month-old who has a hemangioma on her right cheek, and we started propranolol probably about a month ago. I've been talking to a dermatologist that's one of my friends, and she's with like a world-renowned hemangioma specialist up in New York. But I was just curious, as you're talking about that, when you were mentioning about like rosacea, that it would be helpful with that, with the vascular, formation with the hemangioma, just like the vascular like conglomeration. I was wondering if that would be beneficial for her as well.
How about this? Chelsea, are you a staff member at LUX, or are you a guest? Are you a patient that's on the event?
I'm a guest. I was really interested in learning about it, and then I know they also said they were doing like a giveaway too. So I was interested in learning about it, and once you started talking about it, and I was like listening about the rosacea period, especially, then it got me thinking about my child and the hemangioma and stuff. So
what I would prefer to do, rather than give medical advice on this, I know what I think. I mean, I know what I know, but I don't want to step out of line. I'm going to send Jasmine and the staff at LUX some studies that we've done on processed skin proteins, and allow them to make a medical evaluation. And I mean, Jasmine, would you be willing to get back in touch with Chelsea and maybe the derms or Erin, one of the PAs, kind of review the study and see what they would recommend?
Yes, yes, absolutely.
Okay.
It's a great
I'll get
question,
that to you.
Chelsea. Yeah.
And if you can see my face, I'm smiling and winking.
Yeah, thanks. That would be great. I hadn't even thought about it until you mentioned rosacea, and I was like, oh my gosh, this might be a good option. I mean, we've been doing it like systemically currently, but we had mentioned like a topical one, and I think like we were thinking like something else, but
I kind of lost you. I think we kind of faded out for a minute. But we'll get that over to you. I'll be sure to. I'll get those pulled and emailed over.
Yeah, Chelsea, so sorry. You're breaking up now a little bit, so we're having a hard time.
Sounds like it's just echoing out.
Yeah, that's right. So sorry, Chelsea, you were breaking up towards the end, but yeah, we'll look at those studies, and I'll have Erin or Christine or somebody contact you with that, if that sounds okay. Can you send me a private message with a good telephone number for you? And I'll make sure when somebody gets back to you. Well, perfect. Well, we are going to have continue to have daily virtual events. So this has been so much fun to, we do open house twice a year, every year, and it's our favorite day of the year. So it's been a big bummer for us and for all of our amazing reps that they can't be here to meet face-to-face with all of our patients. So we really appreciate everybody who's been participating, both patients, employees, and reps, and everybody who's watching on Facebook and YouTube. So just make sure to check out our weekly emails and check our Facebook page, because we will be back again tomorrow at 3 o'clock for another event. Thank you guys so much for joining us, and I'm going to go ahead and sign off unless anyone has anything else.
All right. Thank y'all.
All right. Thank you.
Just leave.